Sam, a breakthrough in migraine treatment. Could it be a cure? No medicine, no changes in diet, just a massage. One Northern California physical therapist says that he has found something that is not being done anywhere else and that really works. And his patients say their lives have never been better.
I have had migraines since I was 13. It would be hard to summarize the incapacitating effect of them.
Zoe Sohn hardly remembers a time that she didn't have debilitating migraines.
And I couldn't look at magazine print, it was too small. I couldn't look at my computer, it was too bright. I couldn't, a glare off of a windshield or something, just in an instant I could have a migraine.
The simplest things could set her migraines in motion, causing her to become dizzy, nauseous, keeping her from her work in publishing, her husband, 3 children, and life in general. She says she was at the end of her rope.
I was in bed with having had one of these episodes of spinning, and I thought, I'm going to go to 3 more appointments and then I'm going to kill myself. And then I caught myself and thought, okay, that's a little extreme, but I felt like I was a burden to my husband.
Enter Sheldon Lowe, a Bay Area physical therapist for the past 35 years. Zoe was referred to Lowe for a neck issue, but quickly found the treatment could double as a way to give her some migraine relief through a simple head massage.
It's my theory, and from my experience, I'm taking pressure off the scalp nerves, and that's taking away the impingement and the causative agent of the headaches.
Zoe says the treatments were the answer to her prayers. So we wanted to know, how does it work?
I'm actually working into the scar tissue and trying to break it down. It's almost like control shearing, like if you're peeling an orange and trying to play that game where you keep the orange peel together and you're trying to work it around so you're not breaking the peel apart.
Lowe showed us first on my hand so you can see the pressure that's applied, then on my head.
Try to find an abnormal lump or bump, and if it's sensitive, that's even better. And I would actually push into it and then maybe twist a bit or even pull down like that, or come into it sideways like that, go that way. But anything that's lumpy is not your skull. It's not bone.
Not normal.
It's not normal.
Since Lowe says the lumps aren't normal, we asked him how those lumps and bumps develop. He says it starts as a small child when we fall.
Once you hit your head and it raises a bruise, the bruise causes a little scarring, and you don't end up stretching it out. It just actually gets tighter as you get older.
Lowe's studies have shown that over time, as the scarring cannot be stretched, it gets tighter, cranking down on the nerve endings in the scalp and contributing to migraine pain.
It's all anatomically related to these adhesions, the scar tissue adhesions on your scalp.
For Zoe and multiple other migraine patients that Lowe has seen, several massage treatments have led to great relief.
Eventually he was pressing on my head and lightly, and I felt worse. And that actually to me was reassuring, because I thought if he can make this happen, then he's into the box, the control box.
Now she says the frequency of the migraines has been dramatically reduced.
Doctors usually treat migraines with medication, dietary changes, and rest, just to name a few. So we came to UC Davis to ask the headache experts, could this treatment really cure migraines?
Dr. Mark Lenartz is a fellow of the American Headache Society and runs the headache clinic at UC Davis Medical Center. He believes the treatment could work.
Freeing inflammatory fluids and humors and freeing the adhesions between tissues is a very important point, and it's worthwhile looking into.
And with more than 38 million migraine sufferers in the U.S. trying to find relief, why hasn't something like this been discovered before?
Probably not enough people really practicing and doing that on a regular basis.
But Dr. Lenartz also believes that while there may not be enough scientific evidence now that says it could cure migraines, he's not ruling anything out in the future.
Their conclusion is we need more scientific evidence, but it's encouraging. And so I think it's worthwhile going further in it.
For Zoe, she's just thrilled it's working for her right now.
I'm so much freer to do things now.
Now, Lowe hopes to publish a book and release a how-to video on his technique in hopes that others can master it as well and bring relief to their patients, too.
Interesting. Very interesting.
Lots of breakthrough material there for many people who suffer from these.
And a lot of people do.
Certainly do.